Really?
Okay. According to the Center for Disease Control, in 2009, 81 dogs and 300 cats were infected with rabies. I work for a veterinarian and have seen firsthand the terrible things that can happen to dogs that have gone without vaccines. I'm sure that everyone in the audience has had a dog and should be well educated on what your dog needs in order to live a happy, healthy life. Today I'm going to talk about vaccinations, younger dog checkups, and older, more geriatric dog checkups. To begin, I'll tell you everything there is to know about vaccines. The rabies vaccine, of course, prevents rabies and is required by the law in every state in the U.S. Normally, dogs can get that shot at 12 to 6 weeks. It depends on owners and the vets. Some vets want to wait until they're 16 weeks, and some owners want to wait that long, and some will do it earlier. And after that, you'll get a yearly booster for rabies, or if your dog is older, you can do a 3-year booster. Just depends on what your vet wants to do. Another important shot is the DHPP shot, which is distemper, hepatitis, parainfluenza, and parvovirus. And you can start that shot at 6 to 8 weeks, depending on what the vet wants. Some vets want to wait until they're older, just for their immune system to be more receptive to the shot and everything like that. After that shot, you'll want to get a DHLPP, which is the same thing, but it's got lepto in it. And you'll do that 3 to 4 weeks after the DHPP shot. And then in another 3 or 4 weeks after that, you'll get a booster. And those are the 2 shots that most vets like to make sure every dog has. Those are very important. Bordetella is a highly recommended shot if you get your dog groomed or you like to board it a lot, mostly like poodles and small stuff like that, 6 months and older. Lyme disease is another important vaccine that you can have. It's mostly outside dogs that vets recommend that too, since they're the ones that are going to get ticks on them, which is where you get Lyme disease, and that's a yearly shot. One of the main things you are concerned about with vaccines is zoonosis, which is transferring diseases from people to animal. Rabies, lepto, and Lyme disease are 3 of the vaccines that your dog should be able to get that people can get, so you can prevent yourself getting that by giving your dog the shot. So now that we have vaccines covered, I'll tell you about getting your younger dog checkups. In younger dogs, it's important to always have a fecal, because most of them are going to have worms, and you'll want to get those taken care of if you want your dog to grow to full size. Or you can just worm your dog every year, and you'll know that it doesn't have any worms because you wormed it. It's important to listen to the dog's heart and lungs. They could have a heart murmur or any kind of a heart problem, a genetical defect, or anything like that. It's also important to vaccinate your dog, of course. We just talked about that. Vets normally like to check their teeth as well. Some smaller breeds tend to retain their baby teeth, so they'll have 2 sets of canines and 2 sets of all their other teeth, and it's important to get those taken out because they can cause the dog problems later in life. And also, teeth can get infected, or if they lose them, they could have a bloody hole or something. Just important for the vet to check those. Most younger dogs also need a heartworm test. And if you have your dog on heartworm preventative, which you'll give monthly or you can get a 6-month shot, you'll have to give the heartworm test every year in order to... Sometimes, like, the heartworm medicine doesn't work, and you'll have to treat your dog for heartworms. And if you get your heartworm test every year, then the company that you bought your heartworm prevention from will pay for your dog to get treated for heartworms. So it's kind of a legality thing to get your dog heartworm tested every year, even though it should be protected by the medicine it's on. There's also x-rays that vets can do. If you feel like your dog might have hip dysplasia, if it's a larger breed or anything like that, you can get an x-ray to see if it has that or will have that at any point in the future. Finally, I'm going to tell you about checkups for older, more geriatric dogs. Older dogs, it's also important to make sure they don't have worms because they'll lose weight. And when you're older like that, the last thing you want to do is worry about your dog losing weight because they probably have enough problems as it is. It's still important to listen to their heart and lungs. At this point, they could have fluid around their heart or harsh sounds, anything like that, and their lungs could be not as good. And there's medicines the vet can give them, so he'll want to listen to that. Just general old dog problems. And as dogs get older, they retain more of their vaccine for longer, since they've had so many boosters when they were younger. So if you want to, you can check your vaccine titers, which is a test to see how many antibodies they still have for those vaccines, and you can start vaccinating your dog less. And you don't really have to check for the vaccine titers to see about the antibodies. It's just recommended. As dogs get older, sometimes vets will make their rabies vaccine last 3 years, so you won't have to come in as much. And their DHLPP shot, you can get it every 2 or 3 years. It depends. If you're in an area where there's a lot of parvo and things like that, most vets will say 2 years is long enough to wait. In places where that doesn't happen as much, you can go 3 years. It's still important to check their teeth. because your dog may need a dental if their teeth are bad, and plaque buildup that can cause heart problems for your dog, so that'll still be important. And older dogs, you may want to do blood work. They could have thyroid problems, they could have bad liver issues, their kidneys could be going out, anything like that. Lots of bad things can happen. Let's see. Oh, vets will normally check for skin issues, and skin issues also go with thyroid. So joint problems, tumors, they'll feel the knees all over and their hips to see if they've got any pain there. They can give you pain pills for that. And tumors they'll want to take off. Some of them are just, tumors you see and it's no big deal. Some of them could be cancerous, so it's always important to look for those. And still you can x-ray your dog for hip dysplasia, so that's always important. See if there's surgeries that can be done for that and everything. And in conclusion, it is important to take your dog to the vet, not only when it is sick or hurt, but even when it is happy and healthy, so that you can keep your dog and yourself healthy. If you really care about your dog, you'll want him by your side for a long time, and going to the vet yearly is important to have a happy, healthy life for your dog. And for yourself, because you don't want to get sick from something your dog got. And if it could have been prevented, you're going to feel pretty silly in the end. If your dog is not vaccinated for rabies at the very least, animal control can take your dog away, and you could have to pay a fine. They'll sometimes even put your dog to sleep. They'll take it away from you and give it to the shelter. All kinds of bad things can happen. It's just very important to, at the least, have your rabies vaccine. This information is from the Dog Time article in 2009, The Importance of Vaccinations. Thank you for listening. Bye.